Welcome back to CT Live. We are here to talk about a very important discussion within our state and across the country, and that's with APT Foundation. They are committed to your care, and here to explain their open access model of treatment is Dr. Lynn Madden, President and CEO of APT Foundation. So let's start a little bit with learning more about the foundation itself. Can you tell me a little bit more about it?
Yeah, thank you, and thanks so much for having me, Abby. We started in 1970, founded by a group of psychiatrists from the Yale Department of Psychiatry, and we have been since that time really committed to the provision of mental health care and substance use treatment. One of the first organizations in the country to deliver methadone maintenance treatment for opioid use disorder. Wow. And today we use a very unique open access model to deliver treatment for substance use and mental health issues. And we have interior to our programs, in our substance use treatment programs, we have access to primary care, vocational treatment services, residential care, and a whole host of other treatment programs.
So the campaign called Let's Break Barriers to Treatments. What specific barriers are you hoping to overcome?
Yeah, I would actually characterize barriers to care for substance use disorders in two main categories. There are what I would call social barriers, and then there are structural barriers. And the social barriers are primarily issues like fear, lack of information, and certainly stigma. Yeah. There's so much stigma about substance use issues, including the treatment of substance use disorders. And then from a structural point of view, you know, you're looking at things like waiting time or the necessity of payment or lack of available services in where you live.
Yeah, so exactly how are you guys, trying to get this message out and making sure it's getting to the people who need it? And, what are the real take-homes of this?
Yeah, medications for opioid use disorder work. So if you have an opioid use problem, that means using heroin or fentanyl, Percocet, those kinds of drugs, your chances of doing well, achieving a 1-year period of non-opioid use are less than 10% if you don't use a medicine.
That's such a minuscule number. There's a lot to achieve here.
Yeah.
What are the goals that you guys have set in place? And what does success mean for this campaign?
Success for us means people begin to reduce their fear and stigma of the medications, of the persons who might need the medications, even if it's yourself. And it's the best sort of what I would call pro-social thing to do. It helps not only yourself, but your whole family, the community. Everyone does better if you do better.
Yeah, we might see really high-functioning individuals all day around, and we don't quite grasp the severity of it. So what are you guys seeing on your end?
What we see in Connecticut is we're doing better than we did in the last 3 or 4 years. Yeah. Last year in 2024, we had just over 900 deaths from opioids. That's far better than 2021, where we were at 1,500. But if you go back to 2015, we were under 800 deaths.
Wow. If there's somebody at home right now that's watching this that, might need help, or maybe they have a loved one that might need help, how can they get in touch with you guys?
Call us or walk through the door. So we have a 203-781-HELP number, right? Perfect. So you can literally call that telephone number. We will answer the phone. Or you can walk into our access center. That's on Long Wharf Drive in New Haven. 6 days a week, regardless of ability to pay. Just walk through the door. We will see you with a licensed person, and we'll work with you and help you figure out what your next best step is.
Say if there's somebody at home right now that might not be personally struggling with an addiction, but they want to support you guys or support people that are, and help get that number down. How can they do that?
Yeah, we have a really excellent social media presence right now. We have a great website. We're on Facebook, we're on Instagram. I'm told that we're on TikTok, although that's a new thing. And all of the resources that we put on these platforms are shareable.
Amazing.
Right, so they give you tips about how do you talk to somebody that you care about, who you think really has a problem, who maybe isn't ready to do something about that. How do you take care of yourself in that circumstance? I mean, all of those are legitimate issues and questions. But one piece of advice I would have for people is don't give up. Don't give up on yourself. Don't give up on your friends, your loved ones, right? Most people actually enter recovery. It's just that the pathway is not very straightforward for a lot of people. And that's what we're really trying to do, is kind of smooth that path, make it easier for people to acknowledge that they need help, or for people they care about to help them navigate that way.
Yeah, I love it. And we're going to help navigate it a little bit from home from CT Live. Again, this is Dr. Lynn Madden from APT Foundation. Thank you so much for joining us today. It was a pleasure to have you.